Along with the snow, many people may be feeling a little under the weather.
Yeah, all across the country, there's a surge of flu cases and hospitalizations. That's the same right here in Siouxland. KTIV's Taylor Deckard has more tonight in Healthbeat 4.
Cough, sore throat, runny nose, headache, body aches. If this sounds like you, it might be the flu. The CDC estimates more than 7 million people have had the flu this season across the nation, 73,000 patients hospitalized and 4,500 deaths. Doctors at Mercy One clinics are seeing the very beginning of the flu spreading here.
I've seen over the past week to 10 days that spike seems to be calming down. We are starting to see some influenza locally now. And RSV is usually yet to come in the late winter to early spring.
Antiviral drugs like Tamiflu should be used as early as possible in people who have flu-like illnesses.
It isn't for the average person typically, so young, healthy people probably don't really benefit much from Tamiflu. And if you are going to get the prescription, you need to be seen within 48 hours of your symptoms. Otherwise, we know that Tamiflu does very little.
Dr. Joyce says it's not too late for a flu shot.
If you haven't gotten your flu shot, we would recommend that you get it now, sooner the better, because it's the #1 way to protect yourself from influenza.
In Nebraska, 2 pediatric influenza-related deaths have been reported to the Nebraska Department of Health and Human Services as of January 2024. Another virus spreading right now is RSV, making its way around Siouxland.
This year, there is an RSV vaccination for those adults who are older who are at risk for complications of RSV. This is the first year for that shot. You need to get that prescription, however, from your primary care provider. For infants who are at higher risk,
the CDC recommends an RSV vaccine given to the mother during pregnancy or an RSV antibody given to the baby younger than 8 months. For Healthbeat 4, Taylor Deckard, KTIV News 4.